The American Academy of Osteopathy is the subspecialty college, or the specialty college, the SPEC, that deals with manipulation, that really looks at osteopathic manipulation as an integral part, evaluation and treatment as appropriate, as an integral part of every patient encounter. And it's our goal to get every one of you as comfortable as you can be utilizing your hands for evaluation, and we hope treatment as well. Many of you may not know that we do have ACGME recognized residency programs. Okay? Well, not yet. They're all pre-accredited. But think about that for a minute. Under the ACGME, there is an RC, a review committee, and basic documents still being developed for neuromusculoskeletal medicine and osteopathic manipulative medicine residencies. That's a new world order, okay? The challenges are going to be great. They've already proven to be great. The challenges also open up opportunity. Opportunity for you, opportunity for all of us. There's so many unanswered questions, okay? What about MDs? Do we want MDs saying that they practice OMT? Well, the vision at the Academy is that it goes back patient-centered, okay? It's not necessarily about protecting our practice rights, although that's our job, okay? It's also about having, what's our vision? It is that every patient, okay, has knowledge of, boy, that would be interesting if everybody knew what an OMT was, wouldn't it? And access to osteopathic manipulative medicine. It's a broad vision. Vision statements should be broad. But how are we going to get there? One way is to teach non-DOs, other physicians, MDs, what it means to adopt the principles and practices of AT still, okay, of osteopathic medicine. Wouldn't that be interesting? There are already quite a few MDs who their whole practice is high-end OMT, better than a lot of DOs, because that's what they do every day. So wouldn't it be better for patients across this country if more people knew how to do it and do it well? And I don't just mean treat, I don't just mean OMT, I mean the principles, okay, interrelatedness, and your treatment being based on all that knowledge of the interrelatedness of physiology. All right, so that's that. What I want to do is get a show of hands. Who here is an SAAO member in your chapter? Many of you, thank you. Those of you that aren't, look at the guy or girl next to you and ask them why they are and what they get out of it, okay? Because we'd like you to understand what it's like to come to Convocation, for example, which is in March. Convocation's our annual conference. The students far outweigh the physicians, not far. We have about 500 physicians and we have about 600 students that come. Very interested body of individuals. And the beauty for the students, one of the beauties, is that 2 or 3 nights, there's hours of mentoring. Big rooms. You can go up to some really well-known DOs and you can get some precepting right there. You can ask every kind of question. You can practice your skills and get better at your skills. The students I hear that go, it can be life-changing for them and develop mentorship, okay? So we invite all of you to come and we're excited to have you and try to teach you our brand of osteopathy, which is based on the principles and evaluating every patient from a structural perspective because of the interrelatedness in the central nervous system. Okay, if you don't understand what all that means, that's part of what you need to understand to become a good osteopathic physician and why we do what we do. Okay, it's anatomy, it's physiology. Okay, Dr. Griffin, would you like to?
Absolutely. Hello, everybody. I just wanted to add a couple of pieces about the convocation. One of the things that Dr. Yuha said was that the AOA is actively working on establishing research to help support us in what we do. And probably every one of you has been out on a rotation or heard a professor say something to the lines of, well, there's no evidence for what we do. And that's simply not correct. Most people don't actually ever go looking. One of the things to remember when you are out on your rotations and thinking about the concept of applying manipulative principles to the care of your patients is that physiology is physiology. The more you can explain physiology, the better you will be able to convince your preceptors that you know why what you're doing works, and that, again, as Dr. Newman so aptly pointed out, it's not a belief system. When you do go to the literature to look for evidence to help support yourself, don't restrict yourself to things that have the word osteopathic in it, because physiology does not change regardless of who is investigating it. There's really good evidence in chiropractic literature, in osteopathic literature from other countries, in physical therapy literature. There's a huge movement within looking at fashion, soft tissue, and physiologic principles there. So don't restrict yourself in the physiology doesn't change. At convocation, we do have a poster presentation competition and a case presentation competition that both have some research components to it. And actually, our research committee, the Louisa Burns Osteopathic Research Committee, has a student chapter that focuses itself on research, and they have some great resources. So don't utilize them. That's a huge benefit that a lot of people don't know that SAAO offers them. And I was thinking about when Dr. Becker and Dr. Uhas were talking about their elevator speeches. It is a good way to kind of have something like that, just something in your pocket you can pull out, but again, don't make it memorized. But I sort of have a little corollary to that. When the corollary is you're at a cocktail party and someone says, well, what's the difference between an MD and a DO and a chiropractor? And the answer is that MDs and chiropractors don't have to explain what they do at cocktail parties. So be really clear about who you are and what you do, and don't be afraid to share it, because you guys, people are listening to what you have to say. You guys are the future leaders. So you're leaders now, you will continue to grow in that role. Be really clear about who you are. Okay?
That's all we have.